Hi, everybody. It's Nancy Reyes with For Your Canine.
Lisa Bataska with Canine Defined.
Joanne is going to be joining us a little bit later. So I want to introduce our guest today. Let us know you're there. Today we're going to be talking about cooperative care at the vet and what skills your dog needs to develop for vet visits to make it pleasant for the veterinary staff and your dog and yourself. So we have Liz Vanderhoef and Bree Sochacki. They both work at For Your Canine, and they do a lot of the cooperative care training and basic and puppy and some of the behavior classes that we have. So today we're going to really focus on what your dogs need to learn or know to go to the vet. I know sometimes we don't think about it, and many times it's the norm that the dog should be scared about going to the vet. I don't think that's a true statement. I think dogs can enjoy going to the vet. So my dogs love going to the vet. They all enjoy it very much. I think my Beagle is the only one that's a little bit worried, and I think it's because of where she came from. And so far, we've been doing a lot of happy visits. She gets to go along. They weigh her. They give her a cookie, and then she goes home. So it's coming along. And she's never wasn't really that worried, but I always want to make sure that the vet is a good experience for the dogs, because it's something they have to do in their lifetime many times. And if, Lord forbid, if there's a illness or some major thing that the vet is something like the doctor for us is inevitable. They're going to have to go. So what we want to do is to make sure that they have some skills that you can teach them that'll give them that comfort of knowing, oh, this is what we do here and this is what happens and it's not so bad, so that so going to the veterinarian isn't this big ordeal. You don't have to give them drugs to calm them down and all this other stuff. So we're going to kind of go over some of the things that we find are helpful for our dogs to know and to be able to handle when they go to the vet. Lisa, what are some of the things that you find that is helpful? I mean, do your dogs like to go to the vet, or are they comfortable at the vet?
Yeah, most of them are pretty good. Like Ivy's not really fond of it. Kay will tolerate it based upon the stuff we've worked on, like the chin rest and various things. But she's pretty sociable and friendly to be handled. I think Pan just gets. I think one of the things that we miss too is that just because a dog looks like they're tolerating it doesn't mean they're okay with it.
Yeah.
And when I ask people, well, how do they do at the vet? Because, you want to know how the dog feels when it's uncomfortable, especially when you're working with behavior stuff. And I hear, oh, they were fine. And I'm like, what does that look like to you? Because what it looks like may not be what you actually see.
Mm-hmm.
And so, and to be fair, as many skills as we can give them is critical, because at the vet, there are two places that are kind of hurry up and go, which is grooming and vetting. And, you want to make sure they're comfy with that. So,
mm-hmm. Right. So, Liz and Bree their dogs have a lot of skills when it comes to going to the vet, and they've worked on it quite a lot. So the first thing I am really a big fan of, but I'm a fan of not only for the vet, but for everything, is muzzle training. I think all your dogs should be muzzle trained in the event of, any emergency or any problems or anything like that. I think muzzle training is so important. And so muzzle training is something that, again, because everybody associates it, and there's a big stigma with it that, it's for bad dogs, it's for this, it's not. It's a great skill to have, and especially if they're going to do something that might upset your dog, the muzzle protects everyone, and it avoids the whole big problem, right?
Muzzle training today. I was pulling up a video of Rumor starting muzzle training at 13 weeks. So if that's what you heard. So yeah, I started muzzle training with Rumor at 13 weeks and I can open that video.
Let's see it. Let's do it.
Yeah, so I started muzzle training Rumor at 13 weeks because obviously with being a shepherd is people have their apprehensions about them, and she does come from working lines, and so she is, was bred as a bite sport prospect, and I just wanted to protect her at all costs.
This video is sped up to
So I don't know. Can you see my screen
We
yet?
started muzzle training today.
Do under present, Liz? Did you see it where you can present?
Yeah,
On the-
it's taking a second to load. There we go. Entire screen. Okay. Oh, it's not letting me. Check Chrome. Yeah, it's not letting me share my screen at this moment, but let me fix the settings if you guys want to carry on.
Yeah, send me send me. Do you have a link to it? Send it to me.
Mm-hmm. Yeah.
Where it says private check, send it, and I can put it up there. So in the interim, while you're doing that, Liz, Bree, do you have a demo? Can you demo your?
Yeah, what's funny? It's not really that funny, but I actually, when I first got Bubba, I heard of I think it was like the Muzzle Project or something along those lines, right? And so I actually preemptively started training or introducing Bubba and both my dogs, Harley, to the muzzle. Little did I know that the first vet visit that I took Bubba to, that he was going to need it, and unfortunately, he does not like to be restrained, which understandably so. But so he's here. I can do a nice live little demonstration, of course, as he throws his face into there. So here he is. He throws his face very happily. We introduced this even as a game where, and he'll keep going. He'll pick up his face and put it just about anywhere I put. Wait. So we introduced it as a game that I started putting it onto his face, but it's been a big help for me feeling more comfortable at the vet. Him giving him a game. Actually, the day that we went to the vet and he had a situation of having some feelings about the vet, and I had suggested to put him in a muzzle. I was able to put him in my muzzle myself. He threw his face in there very willingly, even though he had some feelings, and then we were both able to feel a lot more comfortable. This was when he was still very new. This is the muzzle that we trained him with. I'm training him. This is the muzzle that I started introducing him with. It just a silicone muzzle that made introducing the muzzle process a lot easier for me, as you can tell.
Yep. And one of the things, so the muzzle that she has is the one we prefer. It's more like a basket muzzle kind of a style of silicone that's a little softer. I don't recommend, I guess for the vet you can for short visits, but those small cloth ones that go and keep their mouth shut, I'm not really a fan of those because they can't breathe or pant and they can't leave them on for long periods of time. So that I prefer these kind, even though they look scarier, if you will. They're better.
Yeah, I have so the muzzles that I have 2 silicone ones, and then I even have a metal basket one, and then I'm looking at ordering either a biothane or a leather one. Now, while my dogs don't necessarily require them right now, I'd still like them to be used to all different types of muzzles. And I say that because for those of you who have known us for a while, Ruger had a massive back injury in 2021. So much so that he was in a lot of pain that he turned around and landed a small bite on my arm, but he was in so much pain that he responded that way to me. And when we pulled up to the emergency vet office, I said, "You need to bring a muzzle out. He's in a lot of pain." And the vet's office, the techs, when they came out to get him, to put him on the gurney, he turned around, and thankfully he had the muzzle on at that point, but he turned around to do the same thing to the vet tech as they were moving him, and they just were so thankful that he was comfortable in that muzzle, and it didn't add a lot of stress to what was happening in that situation. But that's why I'm a huge that's why I'm a huge advocate for muzzle training, because you just really never know. Like this dog that everybody knows, that loves all people, that is, Nancy calls him her love muffin. I never would have thought that he would be the one to, he was hurt to do that, especially to his owner. So that's why muzzle training is really, really, really important.
Yep. All right, I have the video, so we're going to share that.
Okay, I'm going to throw up in the for everyone the Muzzle Up Project.
Yeah.
Yeah.
Like,
So this is a video of Rumor when she was 13 weeks old, just starting getting her face into the muzzle. What I did is I shaped it. So she really loves shaping exercises rather than luring. And so I would just wait for her to show any interest.
This
in that.
video is sped up to X.
I would mark it with a good or a yes. And then anytime she would put her face in it, is I would start rewarding. And now is I still pull it out and put it on her randomly. I still pull it out and put it on her randomly, and have her like nap in it too. And it's actually the same muzzle. It now like fits her.
Yeah, because it didn't fit her little.
And that helps when they're puppies too, is not to have it so small. So yeah, it was Ruger's. He has a different one now, but it was Ruger's. But yeah, starting it as young as 13 weeks. Now she's almost 2, and like she's totally fine in just that muzzle. So, we were at a point where potentially we would have had to use the muzzle at the vet because she had a really, really terrible experience. And it wasn't necessarily the vet's or the vet staff's fault. It was just a really off day for her. And so that on top of, the health stuff that she was having, she just wasn't feeling it. So thankfully we're not at that point, but she's comfortable in it now in case we do ever have to get back there. So
Yeah.
Yeah.
Oh yeah, thanks Lisa for putting that up. So that's one of the skills that you want to be able to have, like muzzle training. And Jen asked, not sure how to size a muzzle. There's, depending on the muzzle you buy, it tells you what to measure and how to measure it and all that stuff. So you might, if you find one you like, see how they measure it, because it's hard because every muzzle has a different sizing, if you will, depending on the style of the muzzle. So
and a lot of time it depends on the material that's made and your dog's snout size, depending if they're a little bit shorter, a little bit longer, and how wide open that they are when they're panting. Because ideally, like a muzzle to fit a dog when they're in full pant, so you're not inhibiting or hindering them from panting all the way.
yeah, because that's why with some of those smaller ones that are material that closes the mouth, unfortunately, right, Lisa, what's the limit that they can wear that? 20 minutes?
It's not long because they have to pant, right?
Yeah.
And then so then if you imagine, like obviously if they get nervous, we get a little more panty and stuff like that, then it's going to be more challenging. Plus they can't drink and so forth. But yeah, I don't know exactly the limit, but it's not a preference.
I don't know why 20 minutes comes to mind. I'm not sure why that.
Yeah, I think it's like 15, 20.
Yeah, it's something like that, right? It's not a really long time.
Obviously, different circumstances would cause for less time. Like if it's hot out, you want your dog to be able to be in a full pant. But I feel like those cloth muzzles are kind of last case scenario.
Right.
So yeah, I find too that dogs that need to be muzzled, they tend to respond better to being in the basket muzzle versus the cloth one anyway. So, yeah.
All right. So the next thing is that I enjoy. I think that dogs should be able to do is a chin rest, right? That's where they can put their chin and in your hand, and you could use it to check their teeth or other things that need to be done at the vet. So, and that's a relatively easy thing to teach your dogs. And it's really very, very helpful at the vet. If maybe you're not quite yet at the level of having a muzzle yet, or you're in the process of that, this is one, might be helpful if they're, checking your dog or whatever while he's in a chin rest or whatever. Again, you have to you have to train it, right?
Yeah, I like chin rest for teeth checks too. Mm-hmm. Think about it, invading their like mouth space is something that some dogs don't like, playing in their mouth. So being comfortable, I made it a trick. So like with Rumor, and I'll demo it really fast for her teeth checks. Come here, Pop. Is I actually come here. She's like, no, I just don't. I want to sleep. Come here. Not under. Go around. Being uncooperative. No, is I taught her how to push it. So she'll push it, push it. She'll push her hand into my nose, or her nose into my hand, and I will then be able to push it, look at her teeth, just like that. And when we go to the vet,
Yeah.
I tell the vet to tell her the same thing, push it, and that way she can get a full check on her teeth too. So that's an
You know,
alternative.
Liz, does she know the chin rest?
Mhm. Oh, she's like, cookies, please.
Yeah, so I've worked on the chin rest too, and I use that for Bubba because he had a slew of ear infections when I first got him.
Yeah. So hold on 1 second, Bree. But you see, nice where they can hold that in their hand. That's really.
I've always worked on putting a little bit of pressure too on it, so it's not like just a simple. But I want her to be comfortable if like she throws her chin into my hand, can I just grab her face too?
Yeah.
While I've never had to grab her face in a vet visit, I think that's important to desensitize the dogs too as well.
Yeah.
And while we're doing the other thing about the chin rest too is while we're doing a visit and I have her in the chin rest, I use it for her physical exam. While I have her in the chin rest, if she pops her head up at any time while in the exam, is everybody takes their hands off of her because she's saying, I'm not in a space where I can keep my head down. I need a second. And that's the part about cooperative care is that if you're going to do true cooperative care is you have to have the dog be able to opt in and out and listen to those opt in and outs. While my dogs have some cooperative care stuff, sometimes we just have to get things done. But for the most part, we go to a peer-free certified vet who helps us with all this as well.
Okay. Yeah. Totally. So Bree, how about you? And I don't know if you guys can. I'm trying to see if we can make this. Oh, it's not gonna let me do it.
Make it.
Yep. That's all right. So go ahead, Bree.
Yeah, so I also trained a chin rest. I used it for a couple reasons. Well, check his teeth just came as a perk, but I also his ears had some issues. So, he's like, I'm relaxing.
Hi, Bubba.
To check his teeth, his teethers, and I also apply a little bit of pressure, and I can even cup his tension. There you go. And then I focus on being able to check his ears. Okay. Bars. Yeah, a lot of times dogs, and especially with him, he had to have his ears cleaned frequently. He had a little bit of an infection. So being able to get that nice and easily when I'm not fighting him for his head, he's like.
And so you guys, I want you to really notice how happy he is and how comfortable he is being handled, just like Rumor was. The dogs, this is not a terrible thing for them. They really are enjoying it, and it's a part of the drill, right? So it's really so I'm gonna go back to the group layout. So I figured out I learned something new here with I can make it big or small. Anyway, but it's helpful.
I have a chin rest for Ruger on my leg versus my hand because he's more comfortable with the leg. And I transitioned that chin rest from my leg to the couch. And he doesn't put his head all the way down on the couch. Well, in the video that I have, he doesn't because it was a lower one. But for his adequate shot he gets bi-weekly he does essentially a chin rest on the couch while I give him the shot. And he it's not his favorite thing to do, but he's comfortable enough doing it and allowing me to do it. And at first we had to just start with like a pencil or a pen, mimicking kind of the feel of the needle going in. But you can transfer a chin rest to an object as well.
Well, and you guys, this is not to mean that the dogs are going to all just love this and they're going to just going to make the vet visit more comfortable. Yeah. That's all we're looking for here. It's something that's inevitable. We have to take them to the vet. They have to be at the vet. So it's like we're just making it more comfortable for the dog.
And one thing, so a lot of us know that I am a huge fan of decompression for all dogs, regardless if they have behavior problems or not. But I actually do decompression for my dogs pre and post vet visits. So preparing them for the vet visit with things that relax them. So Rumor had to get a blood draw done a couple weeks ago to check her hormones and all that because she's in a false pregnancy. But is beforehand is the day before is we did a decompression walk like the evening before, and then when we got there is like you can do a bunch of things outside of the vet's office too. So letting them sniff around, taking the environment. I asked for simple behaviors like sit down. I did a little bit of tugging with her and helping her decompress that way because that's one of her favorite ways to decompress. Stress and like if your dog is people friendly, is sometimes they need to say hi to the people in the front office moving past, and that's just one thing in our cocktail that I found that she does really well with that we do is she says hi to whoever we come past. And then I implement some pattern games in the vet's office. So I do the ping pong pattern game with her a lot to keep her moving. And then I play a lot of tug. And then when the techs come in is they do the similar thing before we start our routine. And then immediately after the vet visit, is we try to get some sort of decompression time in, whether it's an off-leash hike or just a walk in the park, or sometimes it's swimming or whatever. But is we try to get some sort of pre and post decompression in to prepare as well. So not necessarily all things that you have to do inside the vet's office. You can do things pre and post as well to help your dog feel better about that situation.
Mm-hmm. Yeah, so those are really, so the chin rest, do you have, you said you had a video of Ruger getting a Adequan shot?
Yeah, let me see if I can share my screen now. I think it kicked me out and reset, so.
Yeah. Well, here's the thing, an Adequan shot is basically for dogs, it's, what is it, Joanne? It's it's for
joints.
Yeah, it's like a arthritis joint. It's like liquid injectable lube.
Yeah, glucose. Yeah. Nice.
Yeah, it's for the arthritis stuff.
That's exactly what it is.
I'm gonna also throw in the
I'll send it to you right now, Nancy.
Okay.
comments about cooperative care according to IABC, and it has a video on the chin rest too. Oh, that's not it.
Okay, that's enough.
All right, I'm sending it via text right now.
Okay.
Yeah, so like Joanne said, the Adequan is a shot for arthritis. He's got the back thing, and then he does have arthritis in his elbows and his hocks, really. So,
so sometimes Adequan shots are usually given by the owner, right? Like I used to give them to my shepherd when she was older, and so these are things that you can, I know some people get queasy about it, but if you can learn it or get comfortable with it, it's really great for the dog, and then you don't have to run them into the vet every time you have to do it either. So
it's sending right now. Yeah,
Sorry,
go ahead. Go ahead.
I just said Deb Plowman had a comment here. Vito has a great chin, but gets so upset at the vet that he won't do it for more than a few seconds. So.
Yeah, that's pretty common. So implementing, like Nancy mentioned earlier, happy visits are a big thing. Is going in with like little to no expectations that you guys are going to do anything vet care wise. Going in, practicing the chin rest for a couple seconds as often as you can, and then doing lots of cookies. Depends on your dog. If they're nervous about people, that's a different conversation. But having people toss your dog cookies, or just if they want to be pet, like being loved on, is showing them that the vet is a happy place. So those are some things that you can do to get them used to it. Well,
yeah, so Deb, taking them to the vet, yeah, sometimes I used to do it when Jive and Tango were young. I used to do it on my way to work because I would pass by the vet at that time. And then I would stop in, jump out of the car, take one of them out, go in there, weigh them, visit a little bit, and then get back in the car and continue on to work. Was it challenging? Yeah, because I don't usually have a lot of time to do it, but it is so worth it now because now when I take Tango to the vet, he loves going to the vet. It's his jam. So it's it's a lot more comfortable and stress free for all of us involved. So it's really good.
I like to even add, like even just doing a simple chin rest or anything in preparation for the vet. It's nice even to practice at home with another person that might be taking the position of where the vet might be standing. So you doing a chin rest or even working with the face, and then having someone standing on the side of the dog, because that's kind of a weird position to kind of be hanging out in, and making sure that they're comfortable with even just having someone in the peripheral vision, right? That can even help overcome some uncomfortable situations with the vet for them too.
Right.
Yeah, and I think it's also important to remember to remind people is that when you practice these things, it doesn't have to be hours of practice time. It's 2 minutes here, 2 minutes there that really make a big difference. Because at the end of the day, your vet visits are usually only 10, 15 minutes. And so building up that, we talk a lot about resilience, but building up that resilience to get to that piece where your dog is comfortable for that 10 to 15 minutes in that room is important. So just a couple seconds, couple minutes, not a lot of time, as we want to keep it all fun, upbeat, and positive.
Right. Did you get me that?
Yeah, I texted it to you.
Oh yes, I got it.
Okay. So this is like Nancy was saying, this is just a quick video of me doing Ruger's injection. As you will see at the end, he's a little bit like lip licky, and you can see a tiny bit of the whites of his eyes, but he still allows me to do it. And I think you'll see some string cheese in the video too.
Yeah.
ultimate reward for him.
Oh, let's see. No, it's not. Oops, nope. Sorry, guys. All right, you see this now? Yes?
Mm-hmm.
Okay. Okay, ready?
Mm-hmm. You'll hear Rumor screaming in the background if the audio's on, but that's when she was a baby. So he's got some pieces of cheese like right in front of him at the back of the couch. Is I do let him continuously eat through the shot if he wants to. If he stops eating, as I typically know that was a bit too much. I think he had just finished the cheese. But I give him a little rub. There's like tiny bits of the whites of his eye, a couple of those tiny lip licks. But after that, he was totally fine, and I gave him more cheese. I think I gave him the whole piece. Yeah.
Yeah.
So, we can do that at home. And this is a dog who had 4 emergency vet visits in the span of the year. So when we did go back to regular vet visits, he was like, no. So now we are up to the point where he can do all of this again, restraint free. He gets his blood draws and all that without restraint too.
Yeah, you see him stop a little bit, and he was like, ugh, but he tolerated it pretty well. So,
Yeah.
So you guys, the point of all the stuff is, again, I wish I could tell you that, oh, your dogs are going to just love it. They're going to be really happy, and they're going to be just great. No, this is just giving them some skills to be able to get to the vet. And because, going to the vet is something that has to happen. It just does. Yep. It's like you can't do anything about it. So it's like, then we need to just make it as pleasant as we can. It's not going to be, the only dog of mine that just loves the vet is Tango, my shepherd. He thinks the vet is the best place in the universe because they're touching him there all the time. So it's great. So he enjoys it. Anything they do, the blood draw, even temperature, he's like totally cool with it. He's like, yep, as long as you're touching me, life is good. Even temperature, he's like.
Yeah.
But my other dogs, they're okay and they're comfortable, but they don't love all that, all that stuff. But they tolerate it well, and they can make it. They make it. It's good enough for them to, it's like it's not traumatic, and nobody's, it's not a terrible thing. They get treats, they get cookies, and it's all good. But like I said, the only one of my dogs that absolutely loves a vet. He doesn't need any restraint, any nothing. They just take his leg, they take his blood. But that's just the one dog. I have 4, and the other ones they tolerate, but they don't. They're not like, whoa, this is great. Yeah. They're not that. They just deal with it, like Ruger did with the shot. Right? He was like, all right, I don't love it, but it's okay. I can handle that.
Yeah, and he used to really love. This is why building resilience in dogs is important, but he used to really love going to the vet's office until he had that span that in 2021 he had those 4 emergency vet visits. And there they don't have an option. They just have to do, right? It's life-saving stuff. And so if you find yourself in that situation, it may take a little bit of time for them to get comfortable back at the vet, but I think we spent like 6 months of like true, real, like happy visits, lots of fun, not a lot of pressure at his vet visits after that, to get him back to kind of the place where he was before. And now he can do his, blood draws restraint free. He can get poked and prodded, whatever he needs to get done. But yeah, he's totally chill with that now. So, it's little lady who's crazy.
Yeah. Hey, so do you guys have a video of restraining for because sometimes they take the blood from the leg and sometimes they take the blood from the jugular.
Yeah, so I can demonstrate how I get Rumor to how she gets her blood drawn and how I hold her. I am thankful for a really great relationship with both of my dog's vets, and they let me do the hold if I have to, which I'm very grateful for. But for Rumor, she gets the one in her neck done.
Yeah, the jugular.
Yeah, and so
let me make it big. There you go.
I gotta move my chair. Come here. Middle. So she has a really good middle position already, and so built a lot of value in that position. And then what I do is I will, like, cookie crumbs. She's getting crumbs instead of actual cookies. So what I'll do is I will hold her. She's not being very cooperative right now, but middle. She's a cow. She said no thanks. But yeah, she will come into the middle position, and I can hold her head up while they do the quick. Yeah, middle. Here, let me show them. Good girl. Come here. Put your butt. I'm gonna rip my cord out. Anyways, you get the idea, but she'll come in between my legs. I hold her head up. They do a quick blood draw. She also gets the lidocaine cream or whatever it is to help numb the area a bit.
Oh, yes. Yeah.
Yeah. So those are the things that I do for her, and then Ruger's on his side for blood draws for his back paw. That I don't have, but he has it on IQ. I go over, and he'll lay over on his side.
Yeah.
So, I think I sent Liz a video of I have a side positioning for Bubba that I use for simple body handling preemptively, but that could probably be also used as something similar to that.
Do you have that video, Liz?
Yeah, I'm gonna forward it to you right now.
Yep. So Tim asked, do you teach gradient for handling or restraint? I'm not sure.
Touch gradient.
Touch gradient. Yep. Sorry.
I guess. Well, maybe I guess I'm not understanding the question, but touch gradient, do they going up to the point of where they can be touched without having to be restrained? Is how I'm assuming that question is being asked.
Yeah,
I definitely teach my dogs to be comfortable with the touch as well. I am more comfortable with having my dog in a more of a cooperative restraint. So that way, I don't know. I just feel more comfortable with a restraint on my dog. So
Yep, and the truth is that most of the vets or most of the way they do it, it's going to be, you know what I mean? They're going to be restrained. So it's like the dog should probably be comfortable with that. You know what I mean?
yeah.
Because I wish I could say that they were not going to restrain them, but they're gonna.
So the touch gradient is a fear-free
Yeah.
concept, right? So basically, it's about maintaining continual physical hands-on contact throughout the entire procedure examination wherever possible, acclimating the patient to an increasing level of touch and test intensity while continuously measuring the patient's acceptance and comfort.
Yeah, I don't do that. Is my Rumor needs a break. She just needs a break. That's just who she is. Ruger's usually fine. He could be touched the whole entire time, but I do quick little breaks with her. Is they do her physical exam. I play a little bit of tug to talk about like what our next steps are, and then we move into like the next position. Is I think she would get very frustrated if she had to be touched the entire time or restrained the entire time. So I guess it's dog dependent, but I'm not going to say my dogs have to be restrained or touched the entire time. Even if
I think too, a lot of times, so like my Dutchie, you know, when they want to go in and hold them because they're similar in terms of looks to the Malinois and the Shepherd, and most people have, you know, big feelings about that, which I understand. But usually, like when they try to like restrain her, that's why I was like, no, we need to do this differently, because she'll do a chin rest for them to take blood from her neck. She'll do a chin rest for whatever while maintaining holding position. But you're right. Yes, she does need more breaks than like my border collie. He'll be like, I don't care what you're doing. Just wear me.
Yeah. And I find that to be true for a lot of like the working E type of breeds, is the more that you restrain them, the more frustrated they get. So I don't, it's just, again, it's dog dependent. Is if your border collie is totally fine with it, I just don't think the type of dogs that I will choose to own will be okay with the full restraint the entire time. And it's just dependent on your dog.
Yeah.
Tango would be okay with it, but
right.
For Bubba, that's where he starts to have big feelings, as if someone starts to restrain him, and he doesn't have that autonomy.
Yeah.
So I know when I started, I haven't yet brought him to a vet setting, but him laying on that side position, I really introduced like, hey, can I hold your arm? Can I move your arm? Now, can I put both hands? I put pressure on your body. Can I, and then increasing my pressure on his body. So if in that situation, he can tolerate some, but always giving him the break. But he's a foodie with me, so he'll be like, he just lays down on his side thinking he can't wait for it to be done. But it's in the real setting, especially when there's a second person, which we haven't practiced yet, in that position, he would be less tolerant. Yeah. But we have started increasing some pressure, because there's some times where you have to be able to do it, especially if there's some feelings occasionally. So
so I have the video. Do you see that video of the breed with Bubba?
Just mind, this video was taken today, and I was laughing because I was using his dinner, and he was a little enthusiastic.
Oh, look at the tail! Totally relaxed.
Yeah.
He's like, he's touching me. He's got treats.
Yeah. So then, with my hands, I think my video stopped recording, so I don't have more space.
Ran out of space on her phone.
But I ran out of space. But normally I would then put like 2 hands on his chest, on each leg. Can I move each joint? And those different types of things.
But but for everybody, you have to first teach them to be comfortable laying down before you start handling the dog, right?
Yes, absolutely.
That's really, really important. You don't just lay down and start cranking on them and moving them around and things like that. So it's really important that you just really.
And I used to when I transitioned Ruger back into being comfortable at vet visits and stuff, is I used a like a bed, or the mats or whatever. Is I use the mat and I practice it at home. and then I practiced it outside. And then like even at his rehab visits when he was in like the water treadmill, I'd bring that mat out and just have him chill on that mat, practices over, which is on his side. And then once it came down to like his physical exam and then blood draws, is I had them do it on the mat because he has also associated that mat with relaxation and being calm. And so that helped a ton too, is you can use that mat, practice it at home and in different areas, and then transfer it into the vet as well.
Right. Yeah, because Tim, I think we talked about that before on another one of the Facebook Lives about. I think we talked a little bit about some of the fear-free stuff, didn't we, Lisa? About Joanne, I can't remember. We talked about how that touch grading where they tolerate more and more. For some dogs, that can be more stressful. Sometimes, you know, and this is as you go with all the fear-free and all that. Yes, I think if the dog enjoys it and you can do it that way, it's great. But it doesn't work for everyone. And for some dogs, it can be very, very stressful. Even though we're thinking we're not making we're helping them not be so stressed by it, right? So
that's why I like the pre or at least post vet visit decompression stuff, because it gives them the chance to bring their their levels back to ground zero, and really gives them a chance to possibly shake it off. So I encourage people to, my dog has a hard time at the vet. I give them a couple things to work on, and I'm like, take them for a decompression walk afterwards. And that usually helps the dog also come down, is because sometimes, like you said, it can be really hard on them. And it may take them a day or two to recover depending on the vet visit, even though it wasn't terribly traumatic. It's just kind of how that visit went. But
yeah, and Deb, you're right. Debs are so busy. The vets are so busy, and that is exactly the thing. That's why we, as the owners, need to do some of these things prior to the vet visit, so that they have these in place, so you can be in a little bit more of control. Because it's hard to get them to slow down, especially. There's a lot less vets around, and there's more customers. So that's why if you get your dogs comfortable with that stuff, it'll just make them go a little faster. Yeah. It'll make it go a little faster and a little bit more comfortable. Yeah. And then you can say, hey, can you slow down a little bit, or talk to the vet, or but if you've already got some stuff in place, it might make it easier for the vet, right, to be able to take care of your dog or whatever.
Yeah, so when we switch to vets, is I let them know, and thankfully I've built a relationship with, again, both of my dog's vets, but letting them know too ahead of time, hey, my dog is a little bit nervous about this. Can we take this part of the exam a little bit slower? Or like, what do you recommend that we can do to help them cope a little bit better? A lot of the times maybe a lick-it mat, a Kong or a Topple will help too, barring no resource guarding issues, but is letting them know ahead of time, and maybe they can block out a couple extra minutes too, or, hey, I really want to work on this. So being at the vet is more comfortable for both my dog and for you guys with my dog. Can we keep it a little bit slower in the beginning? And asking them that too. They'd probably, most of the people that I've talked to that are in the vet industry say, yeah, like, we're happy when people tell us, so that way we know how to work through that appointment. So
I think too, the other part of it you want to think about is, Deb, to answer your question, Fear Free is a program that helps vets or anybody working with animals understand the body language, how to approach a dog, etc., and take their time in doing it. So they talk about different aspects of it. But I think one way to be sure that you're getting a vet who is going to take their time would be to look at a Fear Free certified vet practice. However, I know there's a few around me, but there's not tons of them. But also, again, depending on who your vet is, if you have a good rapport, like Liz was saying, then of course, definitely bring that up to them.
Yeah. Hey, I was going to ask Joanne, how do you handle Roscoe going to the vet?
It's a little rough. So we had, thank God, like a really rural vet that we went to. So there's just him inside, and there's only one room, and they only let one human being inside the clinic at a time. So that was awesome because they would go slow, and we had, spray cheese on the table and all that stuff. And he actually did really, really well with that. But and I know I missed the beginning of this, right? But he is that dog where I'm going to do all the things that I can to make it better. But like when I thought he broke his toe,
Yeah.
he gets muzzled, right? And thank God I had a report. They worked with me. They didn't put him out. They let me go back. We stood him on the table and actually kind of shoved his body out and pulled his leg a little bit so they could get his foot in the x-ray. And again, he had the muzzle on. I had to step out when they took the x-ray, but they let me come right back in. So not all vets, especially the bigger ones, are going to let you do that. There's a liability factor there too. But I mean, this is where like all this stuff is amazing. He's a dog that's never going to be there, right? Like he's not doing chin rests for strangers. And, but it's, again, I will do all the things I can to make it the most comfortable experience. And he loves his muzzle. So.
Yeah. And that's what I mean. And the chin rest is for you. So you hold the dog's chin. The vet just maybe is examining the rest of him so that he doesn't turn around and like I said, my puppy, I did teach him the chin rest because he gets a little activated when they touch him. So I want him to just put your face in my hand while the vet examines you and checks you out or whatever, especially for his chiro visits. He doesn't need a lot of chiro, but he just does that so he's not wiggling all over the place. So again, he's not, scared, but he's still it activates him when they touch him. So he's like, ooh, because he's not sure what's happening quite yet. Right.
Yeah.
And then,
I'm sorry. Well, I was going to say, I know we had talked about that touch gradient. And so I was just going to give anyone who has a Doberman or a box or any dogs who have DCM in the lines, you need to work that because echocardiograms are a big part of owning those breeds, right? And other breeds with heart issues. And I will tell you, the pointy-eared one got an abdominal and an echocardiogram unsedated. It was an hour and a half on a table. And he's not a touchy dog, right? So, but we did have to hold him down a bit, but being able to pet him and talk to him and tell him he was brave and he was a good boy. And it was not a fave, but he got through it and he was successful. And, so dogs that don't really care for touch that much, if you have a dog that needs an echo yearly, you're really going to want to work that prolonged touch because it's going to happen. I mean, if you're doing echoes. So.
Right. Well, and that's what I mean. So that's why, and it's so much easier when they get used to you doing it. And then over time, you can maybe have a friend or somebody else that really, that the dog's comfortable with to do it. So they get used to it. Right. Really, really super important. So.
Yeah. And I guess the last thing I have to say about like vet visits and having your dog comfortable there is and I know it's such a hot topic, but talking to your vet about potentially meds to help your dog in a visit if it's that stressful, because we don't want it to be a stressful thing for them. And so if the vet finds that fitting is that'll give you a little bit more time to work through some of this stuff if you have to get to the vet in the meantime. So there's no shame in asking your vet about that. We obviously can't give med recommendations as trainers and such, but that's something that you could talk and have that conversation with your vet as well.
Yeah.
Thank you for adding it, Liz, because I mean, even Bubba, that was something that he has meds for before we go to the vet, and that's something that really helps him, even though he has some of these skills that we've laid down previously, but just to give him that little extra push to be even more successful is really important to us and his feelings towards people.
Right.
Hey, can I ask you a question, Bree?
Yeah.
What did they prescribe you?
They gave us GABA.
Okay. So, and like, I know we're not supposed to talk about meds, but I'm just going to say, right, trazodone is like candy for veterinarians now.
Mhm.
And if you have a dog that's a biter, mention it to your vet, right?
Yeah.
Because I don't know. Like, we're not veterinarians, but behaviorally, trazodone lowers inhibitions. So if you have a biter, they're more likely to bite potentially if that is not a big enough dose. So just talk to your vet, like, I might have a biter. Do you have is that the right med?
Yeah, and being honest about where your dog is at too, with
Right.
vet care and things like that is critical, because it sets everybody up for success. And yeah, like you said, if you have a biter, is be honest with your vet about that. They're not there to judge you, is they want it to be as easy as possible for you, your dog, and for them. So again, there's no shame in asking your vet and talking to your vet about potentially meds and things like that for visits and such. So
Yeah. Well, because and that's the thing, right? If you have a dog that's potential, and I'm going to be honest, if the dog is in pain or hurting, the potential for biting is huge.
Well, just like I talked about at the beginning,
right.
Putting him into the car when he injured his back and he couldn't walk, he turned around and he nailed me. Like, that is not my dog. That is the pain happening.
Right.
And yeah, so, and they gave him meds almost right away when we got to the vet to help him be able to handle that a lot easier.
And so, and that's why that's why, and I know you've heard it, like I sound like a broken record, crating your dog, muzzle training your dog, they're all really important, because they're all things that are going to happen at the vet. The vet is an inevitable in every dog's life. They have to go to the vet. Hopefully less is more, they don't have to be at the vet all the time, but being able to for them to make it a good thing, and especially when they're young, and I'll be honest, I did a lot more with Jive and Tango than I have with my last two. So I have to catch up a little bit, right? He hasn't been to the vet much, but he seems to be, I take him for example, tomorrow I have to go to take Tango to the vet. Well, I'm going to take either the puppy or Roomba with me so that we can have a little happy visit, for them, because they don't need to go to the vet right now. But
yeah, that's what I did with Rumor when I was, raising hers. When I got her, he was just recovering from all of 2021. But he was just recovering from all of those emergency vet visits. So we had a lot of follow-up visits, and he, is I would take her with, and she was just like happy to say hi to everybody and tag along and play with their toy and chew on her bone. So if you have a puppy and you have an older dog, is having your puppy maybe tag along to some of those visits too.
Right. So we talked about muzzle training, crate training, which we talked a little, but we demoed that. Teaching them how to be restrained. It's so important. And with for the blood draw, usually if you teach them middle, that's the first part. And then to be, and you want a nice, gentle restraint. And so I know I am a hugger, kisser, dog squisher. So my dogs are very used to being handled and squished and adored and grabbed and hugged and stuff. So that's not new for them. But for some of the dogs that aren't used to that, they, they can get a little bit worried. So, and if, like I tend to just, grab them and hug them. And I did it a lot as puppies, a lot of hugging and kissing and grabbing and stuff. So they kind of grew up with that. So they're used to it. The one that hasn't had that a lot is the Beagle. She's getting that a lot now because she was really worried when she came to me. So now she seeks it out. I pick her up. I give her hugs. In the beginning, she was like, this is weird. But now she's like, oh, this is great. I like it. And she seeks it out. So she's, so other people handling her is not so challenging either. So, it helps when you're a bit handsy. So Liz and Bree, what other things besides the muzzle training, crate, restraining, the chin rest? What are some of the other little things that we can work on, that we can do that all of us can do at home?
Even something super simple as stationing, even like a place cue for the scale. That's usually the first thing that happens when you're going to the vet. So don't a force onto the scale. Just being able to have just a simple, can we get onto the scale, really sets you up for success right off the bat, because that's the first thing that you're going to see.
Yeah, and not necessarily just like a place mat, but having them step up onto something, different surfaces, because a lot of the times the dog will step on it and they'll be like, whoa, what is this? And I know a lot of places have a mat on it, but still, like, I see that dogs can usually go to a placemat just fine, or step on different surfaces just fine, and then they step onto a scale and they're like, no thank you. So working on elevated surfaces too for those things. My dogs target the scale right away when they come in because they know it's like a pretty high rate of reinforcement. But even though they should be losing weight and not gaining weight. But yeah, that, like the place, again, the pre and post decompression, and then pattern games. So Leslie McDevitt's Controlled Unleashed pattern games are good. So the up-down pattern game is really good. I really like the ping pong pattern game. So my dogs like movement. They do a lot better with movement than just the up-down pattern game. So we do the ping pong game. And then even if you work on the 1, 2, 3s, you can use that as a sustained kind of thing as people are examining your dog as well. You can use the 1, 2, 3 in that context as well. So those are kind of, if you had to work on any top 5 things, it would be relaxation, stationing behavior, chin rest, muzzle, and probably like the pattern games.
Yeah. And those are again, we, like Deb kind of alluded to, going to the vet and having the vet slow down. Sometimes they can't. Sometimes they have a schedule. So that's why the more we can do with our own dogs to get them as comfortable as possible. And again, some dogs are never going to be like, I love the vet, this is great. You just want them to be as comfortable as possible and tolerate what's needed so that you can, get them taken care of, because going to the vet is got to happen for everybody.
Yep.
And Lord forbid there's a injury or something that they're going to be at the vet more, and they're going to have to be, handled more and stuff. So you really want them to be as comfortable as possible. And I would say with my young puppy, I haven't done as much as I needed to with him, because he gets all wiggly and which is a little bit of a little bit of anxiety when he's a little bit restrained. So I know I got to work on it more. Where the beagle is very comfortable being restrained. So she is now anyway, and not that he isn't, but he's not as comfortable as I would have liked him to be. So
one other thing I wanted to point out, because I think husbandry is part, basically a lot of this, right? And then taking care of your own dog, doing nails. So I've struggled a lot with my Dutchie, and people have done all the scratch pads and stuff like that. And so I went online and I found the one flat one, but I wanted to show you because I thought this is really cool. Was one that's curved.
So cool.
Yeah, Amazon. Amazon for the win. So yeah, it's pretty cool, and she does great with it, because usually it's just the 2 middle ones, right? Mm-hmm. And then of course it's not going to get the dew claws, and the back claws are a whole nother,
So Lisa, take a minute, explain why the curve.
So the way the curve is, when the paw is coming down, you're only going to get, when it's a flat one, you're only going to get the 2 middle ones, right? So when they do scratch, the goal would be it gets the other 2 as well, the other outside 2 as well. So, and then you can change the height of it and so forth to.
I've seen people do that with half of a PVC tube, because they snap it in half and then put the sandpaper or the grit paper.
I liked it because it was curvy, but it also has these little handles on the side too. Yeah, so it could just help. So it was just kind of a neat little thing. I was like, that makes more sense. So I just wanted to share that piece.
Yeah, because nails are in husbandry. So again, if you're able to go to happy visits, a lot of vets allow it, and believe me, your veterinary staff will be so happy that your dog is comfortable there, or that to have some training. It's like they just are delighted when you go with a dog that's easy and there's no wrestling involved. They really like that. They like it when they don't have to do that. You know what I mean? It's just everybody's happier, and also you won't miss anything. Meaning, sometimes if you're too busy, trying to restrain the dog and do all the stuff, you might miss a medical thing or a bump or something that maybe you would have the vet would have been able to get had the dog been more comfortable, doing it. So,
For sure.
anything you want to add? So, Joanne, how's Bam at the vet? He likes the vet? Yeah.
He likes everybody but the male vet that he has, and unfortunately, it was the male vet when he had Parvo as a puppy.
Oh.
So he's like, "You, I'm not so fond of." But it's so funny because he comes in and he's like, "Oh, this is the one of yours that doesn't like me." I'm like, "I'm sorry, but yes." And so he instead of doing all the stuff in the room, he just has the girls. I say girls because all their vet techs are women, but take him out into the back and do blood draws and stuff like that. And they're like, "He was such a love. He did great." And Rob's, Dr. Rob's like, "It's just me." I'm like, "It is. Sorry." So, he's a grudge holder, I guess. But that's one of those things, right? When he had a rough adolescence and puppyhood, he had Parvo, he had an obstruction surgery, he, had a lot of things. And so I'm glad he's gotten over it with 98% of the vet stuff. But otherwise, yeah, he's great except for that one vet.
Poor guy.
I know. And he's the sweetest, nicest man, too. So.
And Ruger does better with the male vets versus the female vets, which I was shocked by. And that's why both my dogs have separate vets. Because Rumer does great with Dr. Gunderson and Ruger does great with Dr. Flavin. And I'm like, I'm just going to leave it how it is.
Yeah.
So.
And I know Bubba, he doesn't like to be manhandled either. So how does he handle the vet?
So I know that he typically has a preference towards women than men. So our vet actually we have a questionnaire that we get to fill out. I also see a fear-free vet certified vet. So he sees a female vet. He's fine until we have to have our vaccines or all those kinds of things. But typically there he doesn't have to be muzzled unless it's one of those things. So usually we can maneuver everything and he's just fine. There he gets lots of food from everybody. They have a little station filled with whipped cream, chicken, whatever he wants. But yeah, he has a preference too. But it all depends on how he's feeling, if he's needing space. But they give him time to reacclimate as needed. So they really watch his body language with him. And I, of course, I'd advocate as his guardian. I make sure that he gets that space when he does need it.
Yeah. And that's the biggest it's the biggest takeaway, you guys, is you need to advocate for your dog and be able to, because I know we get so focused on it's got to happen, we got to do this, but sometimes you might have to, if it's not life or death, you might want to say, okay, maybe we'll come back or we'll try it again, or we need a break, or can we come back later or something like that. So sometimes those things may have to happen if it's at all possible, right?
Yeah, and I mean, if your dog does have a vet that they're not fond of, it's okay. Put it in your records. I do not want my dog to see that vet. I'm sorry, it's nothing personal. It's just, for whatever reason, I don't want to see that one. So,
right.
Yep,
absolutely. All right, everyone. Thank you, ladies, for sharing your information, and hopefully you found this very helpful. And happy vet visits, and we'll see you all next week.
Bye.
folks.
Bye.